First of all, thank you very much for your time in January when I visited you. You were so kind and explained what you are doing, and I would like to appreciate first.
And we enjoyed meeting you, and we also appreciated the fine gifts. That was wonderful. Thank you.
Thank you very much. This interview is for the journal Anti-Aging Medicine. There are 8,000 membership reading this journal. Focus is anti-aging. We see that anti-aging is preventive medicine focusing on aging. However, in Japan, that health insurance system only pays for the disease treatment. Prevention of the disease is not covered by insurance. So I like to focus today with you that the value of the medicine, especially the preventive medicine.
Okay.
So I understand that you are working with Dr. Michael Porter, who proposed the importance of value-based medicine. So I like you to explain first that what is a value-based medicine to our audience first.
Well, value-based medicine is a concept that Professor Porter developed over the last 15 years with the aim that the goal of healthcare should be value for the patient. And within that context of the goal being value for the patient, value is assessed by the outcomes of care that matter to the patient, balanced by the cost to achieve those outcomes. In a sort of health care setting, there are about 5 different principles that go into this value-based healthcare agenda, and that is the first is to organize care around the conditions that patients have. And in the case of primary care and preventative care, it's to organize care around segments of the population. And by that I mean, if you're talking about an elderly population, a elderly or a very elderly population would be a segment of that population, as opposed to taking everyone from childhood to old age. And the second premise of the value-based agenda is that there have to be good measurements of the results. And the results are, again, the outcomes that matter to the patients and the cost to achieve those outcomes.
Right.
So if we think about your aging population, the segment that we're considering are the elderly, and prevention in the elderly is the same as treatment. I don't want to get into whether you're paid for it or not. We can talk about that in a little bit. But then the measurement has to be what's important to those patients in terms of the outcome of their health and well-being. And that can be assessed in a number of ways by basically asking patients and finding out what's important to elderly patients as they age, and what's the cost to get them to that point of achieving those outcomes. And then the rest of the principles relate to reimbursement. And in the United States, we believe that those various segments of the population should be paid for in a single aggregated payment. So in other words, rather than having payments for little pieces of care, we believe that the payment should be for one large piece of care. So for example, in head and neck cancer, we piloted paying a single fee or being paid a single fee for a year's worth of care, whether it involved surgery, radiation, or anything. But the principle is to is to bundle the payment for one large piece of care. And then the other principles surround giving treatments, and again, we're more in a treatment focus in value-based care in the United States, but in places that can do it best. So doing the right procedure and providing the right treatments at the right place with the right people is that next to last principle. And the final principle is to have an information technology system that collects the data, allows for sharing of data, and allows for the easy measurement of the results of the outcomes and the cost. So that's the basic principle of value-based medicine, and we believe it applies both to interventional medicine and treatment as well as to prevention and to primary care.
I see. I'd like to make sure that usually the cost or the price of the medical care is depending on the cost. For example, how many doctors are working for the one single surgery, how long the surgery takes, those things. So accumulation of the cost. But your point is not only the cost, but also the value to the patient is most important. Is that correct?
Absolutely, and it's a balance. So a high value intervention would be one that achieves a really good outcome at a relatively low cost. And conversely, a low value intervention would be a very expensive intervention that did not produce a very good outcome. So It's a balance, and it's done from the patient's perspective.
I see.
It's what is of value for the patient.
The treatment might be easier to evaluate the value, but for the prevention, usually it takes time to see the result. For example, exercise or the supplement, year or 2 or 3 years it may need. So what is your strategy to evaluate the value of the preventive medicine?
Well, let me say that it takes time to evaluate all of these outcomes. Most of what we're talking about are large time frames of treatments to evaluate what is the long-term outcome of both treatment and prevention. So when we talk about outcomes, let's say for cancer care, we care about the 5 and 10-year effect of providing an intervention for cancer. The same is true for prevention. It takes a long time to really know what is the ultimate outcome of that particular intervention. So I don't think they're as different as you might think they are. We sometimes think of as an outcome because a lot of the early attempts at measuring health outcomes were related to survival after surgery. When I started in medicine, as an anesthesiologist, we cared about, did the patient wake up, and did they wake up without an injury? Those were immediate outcomes. But in today's healthcare system, the outcomes that are important to patients are long-term health outcomes. So I don't really think prevention is that much different from what we're talking about of outcomes in a value-based system.
I totally understand. Thank you very much. The other issue is that treatment is covered by insurance, but in Japan, especially the preventive medicine like a supplement, all of them are covered by the pocket money. What is the situation in the United States?
Well, it's just the opposite. And in fact, the United States feels very strongly that preventative medicine is far cheaper than interventional treatments. And so in our Medicare program, which is our payment system for people over the age of 65, many preventative services are completely covered without any out-of-pocket cost to the patient. Again, with the philosophy that preventing illness is a much less expensive intervention than treating an illness. And similarly for early detection, we pay for a lot of early detection services like colonoscopy for colon cancer in order to really provide an intervention. Preventative services are probably the highest value service you can provide. They're usually relatively inexpensive, and the outcomes are usually very, very good if they're followed correctly in terms of decreasing heart disease, stroke, things that affect a great number of patients. So it's a somewhat different philosophy, but I think it's with the same general goal in the United States that preventative care is really a high value intervention.
So even the supplement after the age of 65, those supplements are covered by insurance. Is that correct? It's amazing to me. Yes. Well, yeah. No, it's covered by our Medicare, our Medicare system, but they're, I think there's a greater recognition that these types of services need to be paid for. Another service that's paid for that I think is an incredibly high-value service that relates to aging is having discussions about end-of-life care. And our Medicare program pays our doctors to have those discussions with patients so that patients don't get unneeded ineffective care at the end of life. Again, it helps achieve great value for elderly patients by making sure they don't get treatments that they don't want, that won't be effective, and that are consistent with what they would consider a good outcome. And these are incredibly important investments to make in an aging population. Yeah, I totally agree with you. One thing that I like to discuss with you today is about the myopia prevention. As we have discussed in Boston, that I'm very interested in myopia prevention because it's a real boom and it's a health hazard because some of the myopia patients develop the blindness. And this is not directly related to aging itself, but the human is born in hyperopia, and with aging, they develop myopia. So, and I like to, calculate the value of this prevention of myopia. Do you have any rough idea what is the best way to approach for this project? Well, that's a somewhat difficult question because it's hard to put a true monetary value on a preventative service without knowing the exact costs that are incurred. So the approach would have to be to carefully look at what the costs of care are for patients who develop the problem. Oh, I see. So evaluate the current situation. Yes. Yes. Yeah, and then estimate if you were to prevent that, what would be the cost savings, per year of life. And in some manner, if you prevent the condition entirely, as you're, attempting to do, then it becomes a relatively easy calculation because
You know how much the intervention costs,
Right.
and then you know what the costs of treating it are. And it's possible to assess that. And of course, nobody, again, the obvious outcome, you don't have to ask too many patients whether they want their vision or not. Having preservation of sight is a pretty much I would imagine a uniformly desired outcome of any intervention that was done. So the economic evaluation would have to be what's the cost of the treatment of the condition over a lifespan, over however many patients would be expected to get it, and then what that cost savings would be by preventing it, balanced by whatever the cost of the preventative measure.
I see. So once the value of this, for example, preventive medicine, the myopia is evaluated, usually, so can we negotiate with the insurance company to cover these value?
Well, I'm not an insurance company myself, so I don't know what they would be willing to do in Japan. I know in the United States, insurance companies are very anxious to pay for preventive services, just because they know that the overwhelming likelihood is that the cost of prevention is going to be much less than the cost of treatment. I would say with the right data, it would be very much within the U.S. reimbursement system, which is mostly private insurance before you turn age 65. It would be very likely to be something that was fully reimbursed.
Thank you. This is a real shocking finding that you in the United States seems to have a agreement that preventive medicine is much cheaper and more effective than treating the disease itself. I think it's a very nice trend. I think Japanese culture should shift to this preventive medicine, especially for focusing on aging, I think.
Oh, I think so too, because I spent, as I told you when you were in Boston, I spent 20 years working at a cancer center.
Right.
And, we had patients of all ages, but as you know, cancer affects people as they get older with an increasing rate. And cancer becomes more difficult and expensive to treat as patients get older. And as our population in the United States, as I'm sure your population in Japan is getting older, we're seeing more cancers. And had we had the foresight to be able to prevent some of the preventable cancers that are related to smoking and diet and obesity, that would be dramatically less expensive than treating elderly patients with potentially curable cancers. It's not that we won't do it, but it's at such a tremendous cost. Screening for skin cancer before skin cancers become, really untreatable or unmanageable, and early detection, I roll into the same conversation as prevention, because I think a lot of these strategies of early detection of cancer and heart disease and diabetes and other cardiovascular diseases are really incredibly important and in the long run much cheaper than our high-tech, high-intervention therapies that we provide. I mean, in cancer in the United States, the cost of cancer drugs is absolutely astronomical. So if one could prevent a cancer, one could conceivably be saving hundreds of thousands of dollars for each individual patient that had a successful preventative measure taken for either preventing lung cancer or colon cancer. I would think that you would start to think of that a little bit more, because it is much more expensive to treat something than it is to prevent it.
Yeah, this is a very strong message from you, and we have learned a lot. So this is almost the final question, that the future of the medicine, you emphasize the prevention is much, much more effective than the treating the disease itself. Would you like to add something more?
Yeah, no, and let me say that while you're talking about an aging population, I've come to believe that a lot of this really has to start very early in life, and a lot of these things about healthy lifestyle needs to happen in the early education, early in our educational system, and in our community-based programs. Healthcare has for years relied upon doctors to solve problems after they presented themselves. And I think that what we're learning in the United States about the social determinants of disease, the things that are in our environment and in our habits, are just as important as the incredible miracles that can be provided by healthcare. And so I think the future for medicine is that health needs to be not only the responsibility of physicians and doctors and nurses, but it needs to be the responsibility of society in general, and going to our teachers and to our community leaders and to our social programs, and preventing violence and preventing accidental injuries. It needs to be much more of a global approach to population health than just depending on doctors to solve these problems.
Wonderful, wonderful message. So the health is a social responsibility, and not only the doctors, but all the society have to work together for this. Dr. Feeley, thank you very much for your time today. I hope we have a wonderful anti-aging life. Thank you.
Yes, I'm doing fine. So thank you very much, and let us know the next time you are visiting. Professor Porter and I would love to see you again.
Yes. So two things. One is I thank you for the information for January next year's program. I'm now in the preparation of the application. May I have your recommendation letter? Because I need someone to recommend.
Oh, just put my name down on there, yes.
Okay, thank you very much. The other thing is a myopia prevention value study. I'm now reading the book that you gave me. So maybe it takes several months, but after reading all of the concept, I'd like to make some proposal to you. How do we propose? Is that okay?
Absolutely. We'd love to work with you.
Okay.
It's an incredible concept, and as I say, until I met you, I learned so much in one short afternoon, so we'd love to work more with you.
Thank you very much, Dr. Feeley. So, okay, I know that it's nighttime in Boston, so have a good night today, and see you soon sometime.
Yes, and hopefully we'll see you in January.
Okay, thank you very much. Bye-bye.
All right, bye for now.
終わりました。Thank you very much.